All right. Hello, everybody. So let's today talk about hair loss. That's a big one. Big one. So millions of people worldwide, we know, suffer from this. Um, for most people, it's not a totally a cosmetic concern. A lot of it's a psychological issue, a psychological distress, anxiety leading, depression leading, as well. So it's a lot more, and not just men, certainly females, absolutely. When they start losing their hair, all the psychological issues that come along with, you know, going bald. So, um, consequences can be far reaching. So let's explore the science behind light therapy, its efficacy compared to the current research, potential that it holds for those that want something maybe not so pharmaceutical, something that's very non-invasive. So, let's first discuss the different types of hair loss, and then we can go through some of the underlying causes. So, androgenetic alopecia. So, this is the most common. So, this is the male or female pattern baldness. So, it typically follows a genetic pattern. Can start in the late teens, early 20s. With men, it generally manifests as the receding hairline here, thinning at the crown. Women may experience just overall thinning, but particularly in the crown and part line. So then there's the autoimmune condition, and that can be quick. So that can be sudden, patchy hair loss. Immune system mistakenly attacks the hair follicle, so it causes the hair to fall out, typically in like just round, random patches. So it can sometimes resolve on its own, or it can lead to more extensive hair loss. Um, then there's the type where it's a temporary form of hair loss when there's stress put on the hair follicle. So this can be illnesses, hormonal changes like thyroid issues, severe stress, emotional issues, PTSD, and that can lead to the shedding of the hair. And then there's traction alopecia. That's when the hair is constrained, like so tight braids, ponytails, extensions. So that can lead to the thinning of the hair. So delving in to the science, so the mechanisms of action. I'm going to turn this off because it is a bit bright here, but you can see this is the blue red near infrared panel. We'll talk more about that later. There you go, a little bit better. All right, so photobiomodulation, what is at its core? It's light, specific wavelengths of light, and it stimulates cellular function. So we have light penetrating the scalp. So it's absorbed by the mitochondria. Remember in high school, the powerhouse of the cell. Key component, cytochrome C oxidase. So the interaction can lead to the increase in adenosine triphosphate ATP production. So, which is crucial for cellular energy. 90% of our energy daily comes from this and metabolism. So the increase in this ATP enhances proliferation, activity of hair follicle cells, promotion of growth, and reducing of apoptosis, which is cell death. So the research indicates that light therapy can also stimulate production of growth factors. So vascular endothelial growth factors, fibroblast growth factors. So both very critical in hair follicle development. So um, microcirculation. So we know with the release of nitric oxide that comes from light and the cells, we're going to get increased blood flow. So more oxygen, more nutrients to the hair follicle. So that's going to be vital to sustaining healthy hair growth. So the effect can reactivate dormant hair follicles, and it can encourage them to kind of enter the anagen phase or the growth phase of the hair cycle. So we also know with light therapy, red, near infrared, predominantly anti-inflammatory effects. So any kind of chronic inflammation can hinder hair growth. It can damage the hair follicles. So with the anti-inflammatory properties, we're reducing scalp inflammation. So we're creating more favorable environment for the hair growth. So particularly important with individuals suffering from conditions like alopecia, areata, where the inflammation plays a key role. We also know with light therapy, cellular repair, regeneration. So promotes regeneration by stimulating the activity of fibroblasts. So that fibroblast is, that's the collagen. So elastin. So extracellular matrix component. So can strengthen the integrity of the hair follicles, and this can enhance support for further promotion of hair growth, improve the overall health of the scalp. So clinical efficacy of light therapy. For hair loss. So the good thing is we've got a lot of really positive studies using uh, red, near infrared, pulsed, and now we're getting to some more that we'll talk about soon, blue light. So really good study, randomized control, published by the American Journal of Clinical Dermatology. So significant increase in hair density after 24 weeks of treatment. So it's not an over the night thing. I don't think anyone would expect that, but 24 weeks of treatment, uh, no side effects. Participants experienced increase in hair count, but also reported improvements in hair thickness and hair health. And they're going to do that by literally, they'll take a very close up picture and count. And then they come back subsequent times and they'll do the exact same picture, same place. And they next to get close enough in microscopically to determine the density of the hair as well. So the width of it. So that's the thickness. So one study, men and women, androgenetic alopecia. So saw statistically significant increases in hair density compared to those using the placebo device, which is the no light. So this highlighted the consistent use of light can lead to visible improvements in hair growth and quality. So now let's jump into the blue light part. So we know blue light has generally been known for antibacterial properties, really good for dealing with people with seasonal affective disorder come wintertime, used a lot for treating acne. Um, but the benefits for hair loss have been less clear compared to red and near infrared light. So it's coming, more and more is coming out. So uh, with blue light, we know we've got that antimicrobial properties. So blue light can help reduce if we've got scalp inflammation, if we've got any kind of bacterial or fungal infections on the scalp. So that can indirectly affect hair growth. Some people deal with eczema or psoriasis of the scalp as well, which we know blue is good for. Hormonal influences. So some studies suggest that blue light can help regulate certain hormones, so which can impact hair growth. So still emerging on that. Certainly combination therapies they're working on. So blue in combination with red and near infrared. So we're getting the very shallow penetration of blue affecting uh, the media cells on the scalp. We're getting red going in deeper, increasing blood flow. We're getting near infrared going even deeper. So a couple good studies using blue light. So there's photoreceptors present in the hair follicles, so they seem to be capable of eliciting hair growth. So the study aimed to demonstrate that blue light's effectiveness on hair growth in patients affected by alopecia. So 20 patients enrolled. That was at the Magna Gracia, if I'm saying it right, University Unit of Dermatology. So they use blue light, 417 nanometers, 120 joules centimeter squared, power density, intensity 60 milliwatts centimeter squared. So twice a week, that's all. Twice a week for 10 consecutive weeks, so a total of 20. Patients evaluated 1 month after the end of the therapy. Um, uh, and dermoscopically. So, they were looking really close, really close. Uh, so hair density, hair shaft width was recorded in 90% of the patients after 10 weeks. Photographic improvements was noted in 80% of the patients. No serious side effects, if any. Only side effect I'm reading here was, a little bit of a darkening of the hair, and that's maybe due to melanic stimulation due to the blue light and like two patients. So really positive studies just using uh, blue light continuous wave, non-pulsed in this case. Another study, this was done on mice. So always with a grain of salt, but there's a reason why they study mice. So they use external light. So the external light, meaning just out to here, activated hair follicle stem cells through the sympathetic neural pathway. So simply taking mice, eyes opened, blue light, stimulating the sympathetic activities. So it's a release of norepinephrine, which activates hair follicle stem cells. And the neural circuit enables prompt communication between peripheral tissues and the external environment. So yeah, pretty wild that um, light through the eyes is actually affecting hair growth on certain other areas of the mice. So certainly something that can be ongoing, and hopefully they'll start to do more similar studies, but do them in humans. So like I said, hair stem cells. So, and that's where we're really start delving in towards uh, systemic light. So we always talk about, hey, let's put a cap or a helmet on the head for hair. Great. Totally good. But we're missing out. So when we talked about earlier, all the different types of hair loss, a lot of them are coming from hormonal issues. So not directly related to the scalp. A lot of them may be coming from gut issues. They could be coming from kidney problems. They could be coming from uh, poor sleep. They could be coming from stress, depression, PTSD. Uh, so we got to remember, the body as a whole, the body is a system. So as much as we want to put light right here, we have to realize that putting light in other areas might actually give us more benefit. Um, so that's why I'm not opposed to specific devices that have one purpose. Like I'm not opposed to a cap or a helmet for hair loss. But I think we're missing a big part of the puzzle, which is the system. Uh, so that's why I use my panel, and it's just easy because I'm being able to treat the great majority of my body in one session. So if I'm standing or sitting in front of it, I can easily get the receding part here. I can get the crown here by just putting my head down for a few minutes. While I'm doing that, I'm getting all the blood supply here. I'm getting the organs. If I want to get my thyroid, I could just lift my chin up for a few minutes and get that area as well. I'm getting the gut area. And particularly if I'm pulsing it in the morning on that red near infrared blue, 40 hertz, I'm reducing my melatonin, increasing my serotonin, getting more energy. I'm balancing my circadian rhythm so I can sleep better. I'm reducing potential issues with seasonal affective disorder, PTSD, depression. When I turn around like this and I'm facing my back, so I'm getting all my spine, I'm getting the lymph node in the back of the neck. I want to get here again, I can just tip my head back for a few minutes. I'm getting the kidneys as well. So we can see how important the body is as a system. Now, what are the devices? So beyond the panel, a pad system can work. So I can simply be placing this here. Now, again, that's just focusing on this, but with a pad system, I can also be getting the thyroid, I can be getting the stomach, I can place it on the back area as well. It's just going to take more time to move it around to those areas. I mean, we can go as small as, the torch. Time consuming, certainly, but if I'm constantly on the go, or if I just have a couple spots that I need to focus on, I can do that with this, and here I can get the thyroid, I can get other areas. But yes, it's time consuming to use something small like this for generally a bigger area and for systemic purposes. But we can combine devices. We can easily have one of these and have a cap. Um, we can have the panel, and then when I'm on the road, I can bring the torch with me. Maybe I could bring the pad with me, and that can make it easier. It's just a matter of time versus budget. Uh, but I think to highlight this is to say, red and near infrared have always been the ones that we've gone to, and that's shown positive results for hair loss. Blue on top of that, I think, has really taken it up to a next level. And then we can get into pulsing. Good research showing that pulsing has showing benefit for hair loss as well. So hence why with my devices, I've got the combo unit, which has the red, near infrared, and the blue, and it pulses as well. Torch, red, near infrared, blue, uh, pulses as well. Just anecdotally, I've noticed, I've been using red and near infrared for many years, and I'm sure it's helped my hair loss. I mean, you can't see it here, but it's been there for some time. It wasn't until probably about 2 years ago that I added the blue to the device, and I noticed a significant difference in the amount of hair coming out in the shower. And no other variables that I could possibly think of. So I think it's benefited me greatly with, at the very least, slowing down my hair loss. And for a lot of people, that may be all it is. It may be just, let's slow the process down. Maybe we can halt it. Maybe we can even grow it back. Everyone's going to be a little bit different because there's so many variables out there causing this, and everyone is different. Um, and there's nothing wrong with combining therapies as well. So I will use microneedling. People a lot of times use that for skin issues as well. So microneedling can be a good combination. Minoxidil, you could do that as well. There's also some more natural, I can't think of the name now, but some more of the natural products that can have really beneficial effects as well. So there's absolutely nothing wrong with using light therapy as just one of the modalities to try to deal with the issue of hair loss. All right. I hope that is helpful for you, and I will see you all soon.